So we're going to start by looking at different types of inflammatory rashes, and then work on understanding ways to treat the different types of things that people call eczema, which can actually encompass a whole bunch of different types of skin conditions. And then we're also going to focus a lot on psoriasis, the different types of psoriasis, how to evaluate how severe it actually is, and then talk about treatment options for plaque psoriasis in particular. So when we get a rash, we want to start by just looking at the rash itself, characterizing it. Where is it located can provide you a lot of information about what is causing the rash. When we talk about appearance, we want to do things like look at the color of it, the shape. Is it circular? Is it spread out? Is it clearly defined, meaning it looks really different from the surrounding skin? Or does it seem to kind of blend into surrounding skin? Is it raised? Is there anything coming out of it? Are there cracks? Is there flaking? Is there itching? So those are all things that we want to consider for rashes. And, I'll say right now that oftentimes when people come in to the practice that I'm in with a rash, particularly one that's very itchy, they're irritable and they just really want to focus on the rash. Like, I just want it gone. You don't need to know about everything in my history, but actually it can be very helpful, in particular whether that person has a history of atopy. So allergies and asthma and atopic dermatitis are considered an atopic triad, and they often go together.
Part of what happens in atopic dermatitis, which we believe contributes a little bit to the pathogenesis of it, is a infection of Staph aureus. So we know that Staph aureus is a common normal skin flora. And so when patients have disruption of the skin barrier, sometimes Staph aureus will colonize in those areas and kind of lead to an overlying infection.
And there's natural emollients too. I mean, not that some of the ones that we mentioned were natural, like vegetable glycerin, but when we look about what's already in our skin, sometimes we can use some of those nutrients therapeutically. So ceramides are a type of lipid that's in the skin, and they help keep water in the skin. That's their purpose, or at least one of their purposes. And if you look at that chart on the very top, you can see that it's showing you in a typical person, adult with healthy skin, there's a black line around the outside, and that's supposed to demonstrate that there's a good barrier protecting the skin.
As far as nutrient deficiencies, so we want to talk a little bit about diet, specifically, vitamin A. Sometimes we've seen that deficiency, any of these nutrient deficiencies have been associated and can contribute to making atopic dermatitis worse. So vitamin A, vitamin D, we've seen that if there's a deficiency and we go in and correct it, potentially we see some improvement in atopic dermatitis. So I'm always about testing before giving huge doses of vitamin D to make sure that I'm able to optimize my patient's levels of vitamin D. But I do commonly see an association of low vitamin D with atopic dermatitis. When it comes to assessing the severity index, very similar to the EASI score is the PASI score. Again, this isn't something that you may commonly do in office with your patients, but if you're reading through any clinical studies, it's important to have some kind of objective measure on how to track treatment and reaction to treatment. So there's a couple of resources here that you can use to kind of help grade your patient's psoriasis severity. Our first approach is, decreasing that inflammation, looking into potential dietary factors that are aggravating the psoriasis, doing a combination of both internal and topical inflammation modulators as much as possible. The more anti-inflammatory effect that you can get, the better.